Good day, everyone. We are Group 7, Katrina Alberto, Bianca Balajadia, Jeremy Chian, Erin Beatriz, and Lilac Racelis, and we will be reporting about the sex reassignment surgery. So the topics or points for this discussion are body dysmorphia and gender dysphoria, a background on sex reassignment surgery itself, types of sex reassignment surgeries, the procedure, and advantages and disadvantages.
What makes a person go through SRS, or what are their reasons for undergoing this particular procedure? It may be due to their body dysmorphia and gender dysphoria. BD, or body dysmorphia, is a mental health condition. It is an anxiety disorder that causes individuals to worry about and have a preoccupation with a perceived flaw in their outer appearance. These flaws are often unnoticeable to others, yet they suffer having to deal with looking or acquiring a trait of theirs that they dislike. Individuals who experience body dysmorphia have a distorted view of themselves. It affects both men and women. GD, or gender dysphoria, occurs with some transgender and non-binary individuals experiencing an additional struggle in which their gender identity doesn't align with their bodies. Hesitancy and self-doubt are fueled by societal expectations around body ideals and gender norms. GD is when there is a mismatch or a sense of disconnect between gender identity and one's assigned sex at birth. The dissonance between what feels internally true versus what is externally seen and perceived by others can create suffering and distress at the expense of one's body. Although gender dysphoria is more pervasive than just with one part of your body, gender dysphoria can be eased by changing it.
Sex reassignment surgery is also known as gender reassignment surgery, gender confirmation surgery, and more. It is one of the options available that help transgender and non-binary people to live according to their gender identity. This involves surgical procedure that changes their sexual characteristics in order to match with the gender they identify themselves to be. Its aim is to reduce gender dysphoria or body dysphoria, thereby improving their quality of life.
Not everyone who is transgender or non-binary chooses to have surgery. In opting for sex reassignment, there are also non-surgical options. Depending on age and preferences, one may choose hormone therapy to increase masculine or feminine characteristics such as the amount of body hair or vocal tone, puberty blockers to prevent one from going through puberty. The most commonly used puberty blockers are gonadotropin-releasing hormone agonists, which suppress the production of sex hormones, including testosterone and estrogen. Lastly, voice therapy to adjust one's voice or tone or help with communication skills, such as introducing oneself with new pronouns. While these are the non-surgical options, we will focus on the different types of sex reassignment surgeries available and is practiced today. Since gender-affirming surgery gives transgender people a body that aligns with their gender, it may involve procedures on the face, chest, or genitalia. Facial reconstructive surgeries alter the face to appear more traditionally feminine or masculine. Top surgeries alter the breasts or chest, and bottom surgeries alter the genitals or reproductive organs. For male-to-female sexual reassignment surgery, the type of facial reconstructive surgery is called facial feminization surgery. This can include rhinoplasty, forehead and brow feminization, facial implants, chin and jaw reduction, lip lift and augmentation, tracheal shaving, and fat injection. For female-to-male sex reassignment surgery, facial surgery can include masculinizing rhinoplasty, facial implants, and buccal fat pad removal. Next, we have chest or top surgery. For male-to-female chest surgeries, breast augmentation, autologous breast augmentation, and nipple relocation can be done. For female-to-male, mastectomy or breast reduction or breast masculinization is a commonly requested surgical correction. Moving on to the genital or bottom surgery, we have penile inversion. Male-to-female reassignment surgery is almost synonymous with the penile inversion technique. This is universally accepted as the most significant procedure in this area. Penile inversion vaginoplasty is a technique of gender-affirming genital surgery that uses primarily genital skin to construct the vulva and neovagina for patients assigned male sex at birth. The advantages of this technique are many, and it is much less traumatic than other techniques. For female-to-male bottom surgery, we have hysterectomy. The removal of the inner female genitals, including the uterus and ovaries, is usually carried out simultaneously with a mastectomy. Although this procedure is not obligatory and has no effect on gender affirmation, it is required to prevent unpredictable hormonal changes on the uterus and to reduce estrogen production, helping the hormonal substitution in general. Phalloplasty. Advances in modern surgical techniques allow us to fully reconstruct the male genitalia using tissue from other parts of the body. Most generally accepted techniques today are the radial flap and the anterior lateral thigh ALT flap. The last procedure which fulfills female-to-male reassignment is the implantation of penile and scrotal devices. This is performed at least 12 months after the phalloplasty when all surgical sites have healed completely. Penile implants are chosen individually, and either malleable or hydraulic erectile devices can be inserted.
So let us now tackle the procedures done if one decides to undergo sex reassignment surgery.
Male to female genital surgery is much more simpler, less expensive, and more successful in general than female to male surgery. That is one of the reasons why fewer women choose to have genital surgery, and another reason is definitely the cost. During this procedure, penile inversion vaginoplasty with a neurovascular neoclitoris, a surgeon creates a sensate neovagina by making like become like by using parts of the original penis. Orchiectomy is the surgical removal of the testicles. The scrotum skin is used to make the labia, and the neoclitoris is made from erectile tissue of the penis. The urethra is intact and functional, and a portion of the skin is used to create a largely functional vagina. For female to male sexual reassignment surgery, the breasts, uterus, and ovaries are removed during female-to-male surgery in two separate procedures. A phalloplasty, typically performed with the radial forearm flap method, this procedure, which can be performed concurrently with a hysterectomy or vaginectomy, creates an aesthetically pleasing phallus as well as a urethra for standing urination. A second stage involves the construction of a scrotum with testicular implants. Now, there is a commonly asked question, especially when it comes to sex reassignment surgery. Can you transition back? It is reversible for top surgeries, but impossible for bottom surgeries. Sex reassignment surgeries that change anything with the lower sexual organs are unfortunately irreversible.
So here are the advantages and disadvantages of sex reassignment surgery. So let us start with the advantages. So transgender individuals who choose to take on a sex reassignment surgery experience long-term mental health benefits, with studies showing the need for mental health treatment decline 8% every year after the surgery. According to Harvard School of Public Health, sex reassignment surgeries have been related to numerous health benefits, including lower rate of psychological distress and suicidal ideation, as well as lower rates of smoking. In a 2015 US transgender survey with 20,000 applicants, around 13% had undergone sex reassignment surgery at least 2 years prior. 42% had a reduced in psychological distress and a 40% reduction in suicidal ideation. A 35% reduction in tobacco smoking among the people who had the sex reassignment surgery compared to transgender people who wanted sex reassignment surgery but have not. The large improvement in one's mental health shows that sex reassignment surgery is greatly beneficial and important to transgender people who seek that affirmation from the surgery.
There have been studies that revealed positive outcomes after undergoing sex reassignment surgery, in which there was a significant improvement in the quality of life. In terms of body satisfaction, a study found that after trans men had mastectomy, their body image and self-worth improved. In addition, there was a decrease in body dysphoria. Furthermore, a study on sexual health after undergoing sex reassignment surgery found that majority of the participants had an improvement in their sexuality. Particularly, the females to males group reported a higher frequency of masturbation than the males to females group. Furthermore, it was observed that females to males group had an increase in sexual satisfaction and sexual excitement, and were capable of easily reaching orgasm.
Now let's discuss the disadvantages of a sex reassignment surgery. With a sex reassignment surgery comes many risks that come from during the surgery, the rehab after the surgery, and long-term effects. So for some risks that come up during the surgery, top sex reassignment surgeries are generally safer than bottom sex reassignment surgeries, but both have the risks of bleeding, infections, anesthesia side effects, scarring from the surgeries, and potential botched surgeries where something may have gone wrong. If bottom surgery was undertaken, then multiple more possible complications may occur. From male to female, the depth of the tissue used for the vagina and vulva may occur. The urethra could get narrowed, blocking the urine flow, causing kidney damages. The skin grafts used might be rejected, and around 30% of surgeries would require a second one. And sometimes, in rare cases, the vaginal hole actually may close, which would guarantee a second surgery. For female to male bottom surgeries, it is much riskier and dangerous than the male to female sex reassignment surgery. The risks are similar in that the urethra could get narrowed, causing kidney damages, the tissue in the nucleus could die, but female to male surgery is much more difficult due to the numerous additional stages of the surgery, as well as the more technical, difficult skills that one has to intake to reconstruct a penis. There is a 70% chance that the patient would require a second surgery, 40% more than the male to female patients. And other post-operative complications for both surgeries include hematoma, and if nipple relocation / reconstruction was performed, the nipple necrosis may occur. And lastly, the guaranteed disadvantage for the surgery, which one must take in mind even if it did go successfully, is that in the process, one would lose the ability to reproduce and to give offspring.
And that concludes our report on the sex reassignment surgery. Here are our list of references, and thank you so much for listening.